If you've been told you need hernia surgery, you've probably heard two terms, open repair and laparoscopic repair. Patients often ask me, "Doctor, which one is better?" The truth is, the best option depends on you, your hernia type and size, your health, and your goals for recovery. Today, I will guide you through both approaches, the latest evidence and a simple way to decide what fits your situation. My name is Dr. Daniel Serralta. I am a colorectal and abdominal surgeon, and over the past 20 plus years, I've observed something very clear. Informed patients whose expectancies are realistic recover better. So what are we actually fixing? What is a hernia? Think of your abdominal wall like a fabric. Over time, a small weak spot can appear and a bit of tissue pushes through, like stuffing poking out of a cushion. Surgery closes and reinforces that weak area, usually with a mesh that acts like a patch to keep the bulge from coming back. Using mesh is a key reason modern repairs have low recurrency rates, no matter whether we do open or laparoscopic approach. There are two simple ways to place that protective patch. Open repair uses one cut in the groin and the weak spot is reinforced from the outside. In some cases, it can be done with local anesthesia rather than a general one, so there's no discomfort during the procedure. Think of a backpack with a tear. Either put a patch on the outside or slide an inner liner to strengthen it from within. Same goal, to make the weak spot solid again, just two paths to get there. The choice depends on the hernia's details, overall health, recovery goals, and the team's experience with each method. What most people care about is pain, speed of recovery, and safety. So let's get practical. With laparoscopy, many patients feel less soreness and get back to normal sooner. Normal meaning going back to work or to sport. That's a trend that we see again and again. With modern mesh, both approaches have strong long-term results, so the patch is what keeps the bulge from returning. In terms of risks, open repair has more skin-level issues like wound discomfort or infection, while laparoscopy carries a small chance of internal injury, still very rare with experienced teams. Different risks, similar overall safety. Now, I will give you a 4-question guide to spot your best fit. Here's a quick yes and no guide to what you can do right now. Is your hernia on both sides or did it come back after a past open surgery? If yes, laparoscopy often shines here. Do you prefer to stay awake with local numbing and avoid a full sleep? If yes, open repair may suit you better. Have you had major lower abdominal surgery before? If yes, laparoscopy can be trickier, so open repair can be smarter. Is a faster return to daily life your top goal? If yes, laparoscopy usually helps you get there sooner. And one more thing matters a lot, your surgeon's experience with the technique you choose. A familiar, well-practiced approach is often the safest and more comfortable. Both open and laparoscopic hernia repairs are safe and effective. The best option is the one that matches your hernia, your health, your recovery goals, and your surgeon's experience. If you are deciding, bring your questions and your goals to your consultation. And if you are preparing for surgery, watch the recovery do's and don'ts next. Small steps after surgery make a big difference. Thanks for watching.